Thank you so much for having me. Thank you, Patrick, for the great introduction. Like he mentioned, my name is Sapna. I'll tell you more about myself in just a minute, but I'm very grateful and humbled to be here with you guys today because I am not an engineer. I'm not involved on the technical side of things. I'm an attorney. I'm a policy advocate. So a lot of what I'm going to talk to you about today is coming to you from someone who has tried to use technology, learn about technology, reported on technology as a journalism student, but I'm still new to the world. I don't understand as much of the intricacies in tech as you all do, so please bear with me if a lot of what I'm talking about is redundant. What I'm hoping to do today is really focus in on showing you a way in which technology might be weaponized and specifically talking about it in the context of reproductive health care. So as you can tell from the title, we're definitely going to be diving in and talking about reproductive justice, abortion access, the law, and then of course how technology relates to it all. To tell you a little bit about me, you're catching me at an interesting time because I'm actually wrapping up my fellowship at UCLA right now. So for the last 2 years, I've been the Sears Clinical Law Teaching Fellow at UCLA. In this role, I've focused my research on the intersection that Patrick told you about, looking at reproductive justice and analyzing privacy and technology regulation through that framework and that theory. My research examines technology as a weapon of reproductive oppression. You're gonna get a taste of that today, but happy to chat more about what that looks like. And then in addition to my research, I've also been able to teach clinical law or experiential education classes, which basically means I'm there to supervise law students as they work on real-world policy issues and public education materials related to laws and regulations. I've been doing that. Before working at UCLA, I was at the ACLU of Illinois, where I focused again on women's reproductive rights and then later privacy, technology, and surveillance. And that's where I worked a lot on both litigation, but then the legislative side of things and worked to pass a number of different measures in the state of Illinois. Before that, I was working at a law firm as a privacy counsel. Now I will be moving to Massachusetts to join their Attorney General's office as the director of their new reproductive justice unit. So this conference is coming at a great time because in this new role, I'm really acutely focused on how can we make sure that our regulations, our laws, our policies really are responsive to the needs of what the technical community needs as well as what consumers need when you look at repro privacy. So it all kinds of comes together in this role, but wanted to be upfront about where you're catching me in this transition. So that's a little bit about me. What we're gonna do today, this is a roadmap of what I'm hoping to discuss with you all. And I'm gonna keep an eye on time. I'm gonna do my best to save some time for questions and answers. But because I am a reproductive justice advocate, I'm gonna start by giving you all a primer on what reproductive justice is. If I could see better, I would do a poll at this time to see how many people know about what RJ means, but I can't see you all very well. So I'm just gonna assume that many of you are learning what RJ is, or at least interested in learning more about it. So we'll start with that primer. From there, we're gonna talk about the legal nuts and bolts. Because I'm speaking to an audience that is fairly well versed on the privacy landscape of things, I won't spend as much time on the privacy regulatory landscape and really focus instead on the landscape around regulating reproductive healthcare access, namely abortion access, in light of the Dobbs opinion. And then we'll make the tech connection. The web of surveillance that's created, how it's impacting access to abortion care. I have a case study that I've prepared to kind of walk you through what this looks like, and then we'll discuss the future of repro privacy. If anything that I'm talking about today is stuff that you already know, bear with me, like I said. Traditionally, a lot of these conversations that I have are with legislators or with other lawyers or with students or policy advocates. So we're coming at it from a very different angle. They usually need to be informed about how technology works. This is different because you all are the experts. I'll probably learn a lot more from you afterwards on how technology works and how our laws can respond to it, but I'm hoping what we can do today is kind of examine the ways in which our regulatory landscape really fails us in making sure that we have robust privacy protections. We have ways for you all to do your work in a privacy protective manner and really make sure that consumers are protected. So with that, let's get started. So we're gonna start with a primer on reproductive justice. Like I mentioned, this is a theory that I really harness in my work and I kind of use as an anchor for everything that I do. This theory was developed by a group of Black women in the 1990s because the mainstream reproductive rights movement at that time really failed to adequately capture the full scope and reality of what reproductive autonomy was and the barriers and challenges to access that people were facing, namely the experience of Black women or other women of color. So reproductive justice really centers human rights, intersectionality, and social justice as a framework to make sure that we're able to understand more about how can each and every person who might have a different way of life or may come from a different perspective or is a different ethnicity or a different race, what are their barriers to access? What is their reality to accessing reproductive health care? Because reproductive rights really only centered white women, and that really left out large swaths of people. So when you keep that in mind, I've put up for you a definition of reproductive justice from Sister Song, which is a Southern-based, it's based in Atlanta, Georgia. It's a national membership organization that's committed to building a network of organizations and individuals that are aiming to improve institutional policies and systems that impact the reproductive lives of marginalized communities. As you can see on this definition, which states that the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. This definition is about a lot more than just abortion. Even though my conversation today may focus on abortion because I'm talking to you about Dobbs, it's really important to understand that abortion is just one piece of the puzzle. There's a lot more to reproductive justice, reproductive health care, and we have to keep in mind the consequences and the ways in which these all interplay and relate to each other. What reproductive justice really recognizes is that there were injustices that were happening in the United States at that time in the 1990s, continue to happen today, that really abuse vulnerable people without institutionalized power. So reproductive justice was conceptualized with the goal of critiquing white supremacy and neoliberalized, racialized capitalism, and to address the gaps in the legal, medical, and political framework that was existing at that time, which left out Black and brown people, low-income people, LGBTQ people, and others. It further aimed to offer a strategic vision and practical movement that built kind of a guidepost for centering those marginalized voices. So how does reproductive justice accomplish this? It does that by splicing together three critical things, which is right here. So we talk about, So like I mentioned earlier, with human rights, social justice, intersectionality, building on the lessons that were learned by human rights experts and scholars through different movements, RJ advocates really sought to root their movement in this justice framework, which is inherently built in pursuit of equity and human rights. Specifically, it's aiming to remove the structural barriers that may stand in the way of people, especially those that are the most vulnerable, from living their full lives. Connecting that theory of human rights is this theory of intersectionality, which is formally defined by Kimberly Crenshaw as the study of overlapping or intersecting social identities and related systems of oppression, domination, or discrimination. To that end, a way to think about this is that if liberation is our goal, human rights are actualized for everybody, and what that looks like is through intersectionality being used as a critical tool to help us get there. With that in mind, one of the key things that this framework helps do is it addresses the oppressive nature of control and criminalization of those vulnerable bodies that I talked about. This brings together this concept of reproductive oppression that really centers a lot of the research that I do. I've placed up here a definition from Forward Together, which is a multiracial, progressive organization that defines reproductive oppression as the control and exploitation of women, girls, and individuals through our bodies, sexuality, labor, and reproduction. The definition goes on to talk about how women and individuals are powerful strategic pathways to controlling entire communities. And the system of reproductive oppression is based on race, ability, class, gender, sexuality, age, and immigration status. Reproductive justice applies these three main frameworks to its change work to make sure that we can get rid of reproductive oppression or address reproductive oppression. It does this through something called the matrix of reproductive activism. This is something that was kind of crafted as a model by Loretta Ross, who is one of our founders of reproductive justice, and it really gives you a frame to understand if reproductive justice is this idea where we want to make sure that everyone can live their full lives and actually have reproductive autonomy regardless of their income, their race, their social status, anything like that. How do we achieve that? We do that through these kind of key components. The first is reproductive health. This is made up of our service delivery folks, our healthcare providers. So your doctors, your pharmacists, anyone that's actually in the business of providing you with the services or the healthcare builds into that reproductive health mode. Reproductive rights steps in and is the legal advocacy model, but it's narrow. It's only legal advocacy in the existing framework of the Constitution, of the rights-based kind of system that we have here in the United States. But we need that. We need folks to be able to litigate under existing laws to protect our healthcare providers and make sure they can continue to provide the healthcare that is so critical. But then finally, you have reproductive justice as an actual mode of activism. Reproductive justice in this sense are your organizers, your community members. These are folks who are really going beyond the restrictions of the Constitution or a lot of the existing legal framework and are invoking a global human rights framework instead to advocate for what they're doing. Reproductive justice as a framework is not meant to put these areas in tension with each other, but it really showcases how they can work in harmony and are different dimensions of each other. So when we talk about reproductive justice, we can't have that conversation without bringing in our healthcare providers, without bringing in the lawyers, and without bringing in the community organizers. So in this context, abortion funds or union folks. So that's really critical to understanding what reproductive justice is. After that crash course, we're going to go into some of the legal nuts and bolts. So I want to talk to you about what the Supreme Court framework looks like before Dobbs even came into play. So first up, we have Roe versus Wade. Roe versus Wade was the law of the land. It was a 1973 case that decided that abortion is constitutionally protected. This was based on the right to privacy. And at that time, the court felt that that right to privacy covered abortion access, given the sensitive nature of abortion care. Roe is also the case where we first saw this trimester framework of a first trimester, second trimester, third trimester in a pregnancy come to fruition in the court and kind of make sense of where abortion can fit in there. It was later limited in some ways in the 1992 Planned Parenthood versus Casey case. This case reaffirmed the constitutional protections that were identified in Roe, but it also established this undue burden standard. This is really important to understand because one thing that, as an RJ advocate, I've often found interesting or frustrating when I'm working on policy work is people always say, let's go back to when Roe was the law of the land. We just need to go back to Roe times. Roe wasn't perfect. All Roe versus Wade did was establish a floor saying, sure, we recognize that you can get access to abortion care based on your right to privacy. States at that point could put in more protections and say, well, we want to protect abortion up until this trimester. We want to make sure that you can access abortion in a meaningful way and get funding for it and get insurance coverage. Or they could still place some restrictions. And that's where a case like Planned Parenthood versus Casey comes in, because it establishes a standard to understand what restrictions are legal. Is the restriction that's being placed going to put an undue burden on the person seeking access to abortion care or not? And for the next few years, the Supreme Court tried to understand what that undue burden meant. How do you define undue burden? There's a little bit more on that here where they're trying to understand what undue burden means, how far can this go? And we saw that in the 2016 case with Whole Women's Health versus Hellerstedt, which clarified that under this test, you really need to make sure whether the regulation's benefits outweigh the burden that it's gonna place on the person trying to access the care. And then in 2020, in June Medical Services, we saw the court actually question whether this balancing test is legitimate or if it makes the most sense to analyze access to abortion care. So already things were shaky. Already there were restrictions that were popping up across the country. And that's what I want to talk about next, is that even before Dobbs, so prior to 2022, when this case was decided, which I'll get into, there were still restrictions and barriers to accessing abortion care. I've listed a range of the restrictions that existed during the Roe era. So some of them include a mandatory delay, which sometimes requires up to 2 visits to a clinic. For many, that means that you have to take 2 days off of work, 2 days away from school, 2 days where you have to organize childcare or transportation. Some states have delays that require you to come in one day and then wait up to 72 hours before you can actually have the care that you need. And in these situations, the vast majority of people who present to a clinic for care are already sure about their decision. They're not coming to this decision or coming to a clinic, traveling to get access to this care, wondering, is this the right thing for me? Most of them are coming having already had those conversations, gone through options counseling, knowing exactly what type of healthcare that they need. Bans on the use of any type of insurance, which requires people to find their own funding, parental permission for minors under the age of 17, unless they're emancipated, requiring that the same physician who's performing the ultrasound must also then provide the abortion, requiring an ultrasound for all people, including showing them the image and describing the image of what you're seeing at that time, even if a patient says no, limiting the gestational period, and then other restrictions that overall had a limited number of abortion centers providing this type of care to people. What this isn't also covering is something known as crisis pregnancy centers, which are essentially fake pregnancy centers that often don't have any medical staff on site, but have popped up around the country in large numbers. So if there's, say, 4 abortion clinics in your state, there's likely 40 or so crisis pregnancy centers spread out across the state at a minimum. And those crisis pregnancy centers are really created to deceive people from actually getting the abortion care that they need, and instead bringing them in, because crisis pregnancy centers are often rooted in religious organizations, and they're really meant to help show people that these are the barriers to care, but you also don't want to get this care, and here's a variety of reasons why. So these barriers that exist are separate from CPCs that are popping up that have been able to kind of stand in the way as another barrier to people accessing the care that they needed. This is all stuff that existed before Dobbs was even decided. So as you can imagine, the ability to get access to abortion care was still difficult, and it was especially difficult for marginalized communities. So I've listed the communities that are often the most impacted and who we always try to center in our work as we think of new policies. So these are folks that are people of color, especially Black and brown women, people that live in rural communities. We include this here because I'm from Missouri, that's where my family lives now, so I've lived there for quite a bit. If you live in Southwest Missouri and you need to get access to abortion care, you have to drive all the way up to now Illinois. There isn't any place in Southwest Missouri where you can access abortion care. But beyond that, for rural communities, there's really only one hospital system that you even have access to, and that hospital system is a Catholic hospital system. So beyond just not being able to get access to abortion care, you're also severely limited in other reproductive health care services and sexual health care services that you can have, because Catholic healthcare systems are regulated by a set of ethical religious directives. So rural communities, if you live in a rural community and you're trying to access abortion care, you likely have to travel anywhere from 200 to 1,000 miles, depending on where you are, just to be able to get access to the care that you needed. Again, all pre-Dobbs. Low-income folks who may not have insurance coverage or be able to find funding to be able to get access to care, young people, LGBTQ people, and migrant communities, especially undocumented folks who may be afraid to access this care or even travel to get access to care. So these are just some examples of people that were already facing a difficult time getting access to abortion care. Then we see Dobbs. Dobbs was a landmark decision that came to be in 2022. The court was examining whether Mississippi's Gestational Age Act, which banned most abortions after 15 weeks of pregnancy, was considered constitutional. In a divided opinion, where we have a majority opinion, 2 concurrences, and a dissent, the decision was made with the supermajority agreeing that the Mississippi ban is permissible and there's no constitutionally protected right to abortion. What's important here is that essentially that right that was identified in 1973 in Roe, that access to abortion existed, in a right to privacy, which is very different than the right to privacy that we understand when it comes to other privacy regulations. But that right to privacy doesn't really mean anything because the word abortion is not in the Constitution. And unless the word appears in the Constitution, it cannot be protected. So you have a quote here from what Justice Alito said that effectively says that. But what that legal grounding effectively does is that it shifted the landscape of what was legal in the country for over 50 years, which was an unprecedented move by the Supreme Court. We've seen as of late that they're not afraid to make those unprecedented moves, so they've made a couple more. But at that time when Dobbs was decided, that was kind of a big kind of red flag, like, wow, they're really changing 50 years of existing case law of what is considered legal. Legal in the barest sense of the word, the most minimum, where we only have a basic floor of protections. And now that floor has been taken completely away from us, and we have no access to abortion. What this meant is that the vulnerable people, the marginalized communities that already had a tough time getting access to care, are now left even more vulnerable. This is a map that I created using data from the UCLA Center on Reproductive Health Law and Policy. We pulled this data examining kind of the landscape of what the laws are like right now. As you can imagine, there were a number of states that had what are known as trigger bans, meaning that as soon as Dobbs was decided, so a decision was made where the states could have restrictions passed on abortion care or bans that could go into effect the minute Roe fell. Those states had those laws go into effect, but since then, in the last 2 years, what we're seeing, or in the last year and a half, what we're seeing, is that other states have also passed additional restrictions, or other states have passed bans on accessing reproductive health care. So on this map, you can see that represented through the blue, both the light blue and the darker blue states, where you're seeing access being severely limited or the dark blue being fully banned. Prior to Dobbs, abortion care was not fully banned in any states. Restrictions existed in a number of those states across the country, but you could still access abortion at some level or through, overcoming those barriers. Now, there are states where you just cannot get access to this care whatsoever. We have seen, because of the Dobbs opinion, a number of states pass additional legislation where they're expanding rights or expanding access to abortion care, but not a ton of them, and you can kind of see where they're spread out. So we're seeing a lot of folks in the South being left without access to care, having to travel up. And really, more than anything, it's just confusing. This is work that I do, and I have to keep up with it. I have to have alerts set up to just understand what is happening in what state. Imagine the average person who just finds out that they're pregnant, realizes this is not what they need, this is not the right time, this is not a decision for them. How are they supposed to make sense of what's going on? So it's a really scary and somewhat dangerous landscape to be in, especially as we're seeing more states pass legislation that is also criminalizing abortion. I'm not going to get into as much of that right now, but given what we know about the legal landscape, about the barriers, about the restrictions, and given what we know about how this makes vulnerable people even more vulnerable, and it also just grows the number of people that are vulnerable to not accessing abortion care, let's bring in technology into this great landscape and see where it fits in. So now that we have this background, we know enough of the historical context to understand that oppression and control are no strangers to those in power. We also know that if there's anything that can help strengthen the power of those that are in power, they will use it and try to manipulate it to their benefit. It's within that context that I want to talk about technology, because technology can definitely be great. It can be incredibly useful, not just for you and I, but also for marginalized community members and others. But the reality is that this technology has often been used by those in power to further control their reproductive health, further control the fertility of communities of color, LGBT people, non-binary and gender non-conforming people, indigenous people, immigrants, and low-income folks. None of this is new. Surveillance as a concept is something that we've been discussing and debating in various state legislatures and in Congress for a very long time. And if you can see in the clippings that are up here, who is being the most subject to surveillance? These are all pre-Dobbs. None of this has to do with the Dobbs decision or abortion access. This is just what the surveillance landscape is like in our country before Dobbs was even decided. And as you can tell, marginalized communities make up the bulk of who's subject to the most surveillance: LGBTQ people, immigrant populations, Black and brown people. And this is both in the sense of private entities getting this data, but then more than that, it's then going a step further of governments and government entities having access to that data, law enforcement having access to that data. That's what creates the system of surveillance that I'm really concerned about, that other advocates are really concerned about. Because when the government gets access to this information that's collected, it can be used and weaponized against them to criminalize them, punish them, but also just to have a chilling effect on their behavior. So with that, we know that we are currently living in an era of unprecedented digital surveillance. Our phones operate as tracking devices that we essentially carry with us everywhere, in our pockets, our purses, our bags, into appointments, to the movies, while shopping, to healthcare appointments. Truly, they go everywhere. Companies recognize that, and they recognize that this could be a way to capitalize on the treasure trove of data that our phones are collecting, our laptops are collecting, our Apple Watch is collecting. And by collecting this data, not only can their tech get better, but it can also be a way to monetize that data. So there's an entire industry now of adware and tracking that's commercially available. We have the Internet of Things that's growing to making sure that that technology is in our homes. And all of this tech relies on collecting our data to make it better. If you zoom that landscape back out to the fertility and repro context, there's a couple things to note. The first thing is that our tech landscape now is incredibly different from before Roe was decided, because the technological advancements that have occurred in the last 50 years are vast. You all know this even better than I do. Fertility and period tracking apps rose in popularity over the last few years, and the massive boom in femtech has ensured that there is no shortage of technology that is specifically catering to the female body. When you keep that backdrop in mind, you will realize that one of the major pieces of advice that was coming out by some advocates and others when the Dobbs decision came out initially was to tell people to delete their period tracking app. That was something that was making headlines a lot across the country, and news outlets were covering this, and they were like, we need to just make sure you delete your period tracking app. The reality is that while those apps are not great, and it's probably good to maybe delete them and opt for a more privacy protective option, that's a really small step, and it's not really going to do much in the broader scale of issues that are facing us. Because the reality is that a lot of the apps that we have on our phone, a lot of the technology that we have, all work together to create a web of surveillance that captures a lot more information about us than we might imagine. This technology is often crafted with this idea that it's giving us control. But as I note, that this control is often an illusion, because we do not have the privacy landscape built in right now in terms of the regulatory systems, the laws that protect us, that mandate companies to ensure that user control is front and center every step of the way. Users don't always understand that. They think that if I'm being asked about whether or not I want cookies, whether or not I want certain things, that means that, okay, this data won't be collected, or I have some semblance of control. Or if you look at it in the fertility context, if I'm able to download this fertility app, that will help me take control of my reproductive health decisions and make sure that I am being safe, I am taking control of my reproductive health. It fails to understand that for a lot of those fertility apps, they're not actually accurate, their algorithms have not been tested, and a lot of the user data is actually going to be fed elsewhere. So this idea that we have control is really limited and not, in actuality, something that people get to live with. So to illustrate that in some ways, and this is just an example of the web of surveillance, I want to introduce you guys to my friend, Anita Wright. So you learn a little bit about her up here. Anita is a college student at UT Austin. She has just started her sophomore year, meaning that she gets to live off campus, and her parents wanted to make sure that she was fully set when she goes to live off campus. So she has all of these things in her home, with her, whatever. Since you all know the technology better than I do, you likely know where this is headed, but this case study is really going to help illustrate all the ways in which Anita's information is getting tracked, where it's going, and who might get access to it. So now that we have a sense of what tech she has, let me just show you what her cell phone looks like. Probably looks a lot like some of our phones. If you have kids, maybe their phones look like this. We'll just kind of keep that in mind. So Anita has been working on a lot of things her sophomore year. She's busy in college, taking classes, but she's also interning at her local newspaper, and she's specifically working on the health justice beat on the paper. So you can kind of see some of the stories that she's written about in light of the Dobbs decision that came out. Given all of her stories, one of her friends, I Want a Choice, recently found out that she was pregnant and had read one of Anita's stories and was like, hey, this is who I need to go to get help, given the status of what's happening in Texas and where I am right now. As a note, this is all happening in April, May, so this is before the most recent movement that's happened with SB 8, where a court in Texas did actually rule that it's unconstitutional. We're gonna kind of suspend that reality for a minute and go back in time when SB 8, the law that not only banned access to abortion care, but also made it to where any person who is helping, as in a friend or a family member that is helping someone get access to an abortion, could also be held liable for up to $10,000 for helping them. And anybody could bring that lawsuit against them. That's kind of the paradigm we're operating under. So went to Anita, and Anita knew exactly what to do. So she made an appointment for the following weekend and booked a rental car so that her and her friend could go on their road trip to be able to get access to the abortion care that they needed. As a note, because they are in Texas, they're in Austin, Texas, there is no access to abortion care in the state. The closest clinic is in Kansas, Wichita, Kansas to be precise, which is 545 miles away. I don't know if you can fully tell what that looks like on the map, but It's quite the distance. And while they called on Monday, May 1st, because of the long waiting period, they weren't actually able to get an appointment until Thursday, May 11th. In the meantime, that's when Anita got everything that she needed. She made sure that she could take care of Anita, so she booked her rental car in a hotel room. She used a credit card that her parents had added her to because it's a rewards card. You got to build up those points. As soon as her hotel was booked, she made sure that she could open up her Amazon app and get some of the things that her friend might need after she had her abortion. So she ordered all those things on Amazon and used that great Prime rewards card to get those points again. Once the day of the appointment arrived, they drove past the protesters that were outside of the clinic protesting, parked next to them, and then held her friend's hand to walk in. And at the end of the day, Anita used her virtual wallet to pay at the clinic because she had some money saved up thanks to her interning job, and she was able to help Iwana out. So, innocent weekend, making sure that her friend was able to get the care that she needed, but what does this mean for her data? I'm gonna just go through all of these real quick. You can see, obviously, lots of data is collected. So, in many other audiences, this is usually where I get a wild gasp, because when I talk to lawyers, they're like, hold on, how much data is collected? A lot. You all, like I said, already know this, but for the average person, for the average lawyer who's not doing privacy work and is trying to become a privacy attorney, it's a lot more than they can imagine. Every single app basically that's on your phone does collect data. I've only pulled out some of the major ones. This does not mean that there's others that don't collect data. I'm not going to spend too much time talking about the data that's collected because that's something that you all will know. There's the portion that's in black that's a little bit harder to see here, but maybe you'll be able to get access to these slides later. But beneath the data collected is a place where we talk about law enforcement access. It lists all the ways in which law enforcement agencies can have access to the variety of data that's collected. You'll notice that every single app that I've pulled out as collecting data also has a section for law enforcement access. That's because in our system of rights-based legal laws, we do not have robust protections that limit what the government can have access to, which means that if there is a subpoena, a court order, or a warrant that comes from law enforcement, that comes from the court, all of that data that's listed or requested in those legal documents in those court proceedings can be furnished, and you have an obligation as a tech company to provide that data. So that can be pretty scary. It can show you how there's a lot of information that's changing hands and can end up in the hands of law enforcement, which can then be used to criminalize folks. I've included some alternatives here and ways to make that better, but what this shows us and what some of the lessons we can learn from this is that a lot more information is implicated than just what we might initially think about. For example, when COVID happened, or when we think about Dobbs and the abortion case, one of the big things everyone tells me is, but what about HIPAA? HIPAA has me covered. No, it does not. HIPAA does a very limited thing. One, because it wasn't really made as a legitimate privacy law. It was created, it's the Health Insurance Portability Act, Information Act, and what it's meant to do is just make sure that your insurance companies are able to get access to the health information to provide coverage and make sure that the claims go through. There is a privacy rule built into HIPAA, but it only applies to covered entities and it only applies to specific health information. So if you're going to your gym and your gym was trying to ask you whether or not you were vaccinated against COVID, that's not HIPAA protected. They're allowed to ask you that because they're not a covered entity under HIPAA. Similarly, if you were to go to a CPC and you get an ultrasound there, a CPC is not a legitimate healthcare institution. It is not covered under HIPAA. If they take an ultrasound, that health information is not protected. It's not protected under HIPAA and it can be shared. But beyond health information, as you noted from the other slide, a lot more data than just your health information is implicated when you think about getting access to an abortion. In this situation, you saw all the ways in which Anita's mail app, Tinder, photos, all of these different apps were collecting data that can then be used to show where she was, what she was doing. Location data is a really good example. Data on social media profiles or when you're searching the web, Amazon purchase history. All of that data is data that's not really protected in many states, definitely not protected in Texas, and even if it was protected, there's a giant loophole within the system that allows government entities to get access to this information. And there's additional risks that there's, beyond the tech companies, it's anyone else that they're communicating with that can share this data. And then finally, repro surveillance, like other surveillance, impacts marginalized communities more than others. That's another kind of major lesson learned from this system. And so how do we address this? I do not have all the answers. I am still grappling with them. Like I mentioned at the very beginning, these are questions that I'm thinking about and wanting to kind of figure out what we can do on the legislative policy side to make sure that we're able to be responsive to the need for heightened reproductive privacy protections and just heightened privacy protections in general. But some things that we have been thinking about are ideas that I know have been floated around with all of you and that you've likely grappled in your workplaces, but it's something that when it comes to regulating privacy has been discussed in a lot of legislatures. And those are the ideas of privacy by design and security by design. Regulators love this idea, and they're really relying on you and companies to do this because they can't really do their job, because they're having a tough time coming up with privacy protections that are responsive to the needs for what people need right now. So instead of taking on that burden for themselves, it's often shifted to you all to incorporate privacy by design, security by design into what you're doing. My understanding is that many of you know what this looks like or what this can mean, but just to go through it real quick, for those that maybe are somewhat new to it, but privacy by design is really the idea of it seamlessly integrating products and services and making sure that privacy is at the forefront of when you're creating those products. So protecting consumer data is a guiding force in the user experience and when you're developing this technology, and there's some examples of what that can look like. There's some guiding principles for privacy by design, so I've included them here to make sure that we're able to think about them. But the first one is being proactive and not reactive. So thinking about really embracing a privacy-first attitude. A lot of companies, what we've seen in the wake of Dobbs is that maybe they weren't thinking about privacy by design when they built out their technology or their fertility apps, for example. And instead of being proactive in building in privacy measures, they were trying to build them in afterwards. And it's a little bit harder to embrace that and add those in after. So in an ideal world, we would love for tech to be creative with privacy at the front end and being proactive. But don't worry, it's not just tech companies, even our legislature has failed, right? Our laws are also reactive more than they are proactive. So this is something that I think I'm saying to you all as a tech audience, but a lot of it is also adopted or something that we try to advocate for legislators to make sure that we too are more proactive than reactive. Privacy being the default setting to where users shouldn't have to worry about their privacy settings when they're browsing a website, opening an app, or logging into software. Other default settings, which could be really helpful and I think are a little bit easier to kind of put in place if you're thinking more critically about reproductive privacy and intersectionality when you're creating your technology, is limiting the collection of data, minimizing the data that's collected, having limitations on the use, retention, and disclosure of information, and then building in security measures on the front end that are also protective of those things. Privacy embedded into the design of the data, full functionality, and making sure that privacy by design is avoiding this false pretense of false dichotomies, such as privacy versus security, and instead understanding that these really are principles that work in harmony with each other and are not in tension, and we need to have both. You can't have a trade-off mentality in this situation. End-to-end security and having life cycle protections, visibility and transparency, making sure that the tech is as open as possible, and then finally, respect for user privacy, making sure that the tech is user-centric with their privacy and their needs in mind, front and center. We also have security by design, which is a similar kind of holistic approach to creating your technology, and it stands in direct contrast to security through obscurity. And so what we're trying to make sure we do when we embrace security by design is making systems free of vulnerabilities and impervious to attack as possible through such measures as continuous testing, authentication safeguards, and adherence to best programming practices. It also means that you're placing a greater impact on building security into the products from the front end. This is becoming rapidly more important, especially as the Internet of Things environment is growing, and nearly every device that we have is in some ways providing a unique identifier and can be networked. While it doesn't have its own set of principles, I think we can really pull a lot of the principles that have been kind of designed for privacy by design and see how it relates to security by design. This chart really showcases if you've had that person who's telling you that, well, privacy might be something I care about, but security, I don't know, or security is something that we can focus on, but privacy, I'm not sure about. They really should work in tandem with each other. They can go hand in hand, and these are some ways to have those guiding principles in the tech that you're doing. And again, while I'm saying it in the tech that you're building, it also applies when we're thinking of innovative legislative policies. How can we make sure that our legislative policy that claims to be, kind of focused on consumer privacy and being comprehensive, how can we make sure that we're thinking about the cybersecurity pitfalls? How can we make sure we're thinking about privacy in a robust way where it's not just your health information or your biometric information, but also your location information or other social information that's collected? So ways to think about these when you're designing your legislation or when you're designing your technology. I've included some of the lessons learned here from some companies and just ways in which maybe they were able to incorporate privacy by design or security by design, or ways in which they failed to do this. So Apple is a great example when they were encrypting their data by default. I think a different example where we see a tech company that does not do that. A great example is through Facebook, Meta. In Nebraska, there was a case that involved law enforcement trying to get access to Facebook messages, and because of the warrant that they had, the probable cause that they had in the case, they were able to access Facebook messages between a mother and a teen daughter. While that case would have been considered illegal under even Roe, it had nothing to do with legitimate abortion care. What it signals is that because Meta had user data, it had access to messages, it did not have end-to-end encryption by default set for users. Law enforcement could come in and get access to Facebook messages that were shared between people. That's a big difference from Apple, where you actually have end-to-end encryption enabled automatically, or Signal, where you have end-to-end encryption and no data is actually stored with the app itself. So just some things to think about. Another example is the Zoom example, where they were able to, they had to finalize a settlement with the FTC regarding kind of their failure to provide end-to-end encryption. And this is after they had also settled another case in 2021 where they violated users' privacy rights because they failed to implement adequate security measures. Just today, I saw that Zoom also updated its terms of services to permit training AI on user content without an opt-out mechanism. They're kind of under fire for that right now and discussing what that looks like, but clearly a moving landscape and ways in which we can think about how could these companies that maybe were kind of caught by the FTC or were kind of not doing things in a privacy protective way, how could those pitfalls have been avoided if they did embrace privacy by design, security by design, or other privacy protected measures in response to the changing legal landscape? And then finally, on the horizon for privacy law, while I didn't spend too much time on this, privacy legislation, much like abortion regulation, is also largely regulated on the state level, meaning that we have a patchwork system of laws that are protecting privacy, and there isn't really a comprehensive national federal law that protects privacy. That's really harmful, but I don't know that there's going to be a quick fix for that, because even though the federal government is thinking about privacy protections and there is more legislative attention placed on it, it seems like we're a long way away before we're going to have a federal fix to think about privacy regulation. But there is an increase in legislation across different states, especially in protecting biometric information. There's also some crafty privacy legislation that's aimed at protecting information that can relate to abortion care. So one of that is location data. Another one is just limiting corporate data or corporate collection of specific data. And I think something that relates to that is this idea of just data minimization and thinking about what data are you collecting and how much of it is actually necessary and how much of it is something that you can actually get rid of. That's been a lot of the discussion that we've been able to see in the post-Dobbs landscape, where companies are paying a closer eye to, do I really need to collect all of this data on users? And now what I would urge you to do is to think about the ways in which maybe people's livelihoods, their safety, and everything can be implicated, the ways in which they might be criminalized, and then keep that intersectional lens in mind in thinking, is this data really necessary? Is this something that we need to collect? That relates to something I want to leave you with. While there's only so much that we can do, I think it's really important to understand that in the context of technology, in our reproductive justice discussions, it's important to remember that there's no such thing as a single issue struggle, because we do not live single issue lives. This is from Audre Lorde. We are not all Jason Bourne. We cannot live in a world where we're completely tech-free. It's going to be very difficult to do that, but it's important to understand the intersectionality that's at play here, and to advocate not only for access to reproductive health care, but to also do that and making sure that we have good privacy protections, robust privacy protections. So I'm trying to do that. I'm grateful to you all for the work that you do, for staying here for the end of the day today, to stay engaged and think about ways in which we can think about privacy and security in a new light, harnessing what reproductive justice has taught us in the world that we live in. I'm gonna wrap up there so that we have about 10 minutes for questions, but thank you all, and I'll take any questions if you have them.
We do have about 10 minutes for questions, and if people do use the Slack channel, there is a SOUPS 23 Keynote channel. I will ask those questions, but I see we already have a healthy line growing. Let's start in the back, and then we'll move to the front.
Sure. Hi. Sorry for that hiccup, but I'm Nidhi Nallor. I'm from Marquette University. This talk was something I was really excited about because I'm actually doing research on femtech apps, so I wanted to ask you questions about that. So it's like twofold. One of the questions I had is like, have you done any research on like privacy policies that are included in femtech apps? If so, what are the privacy policies that I should look for that are unjust and something that basically I should put when I actually come out with this research? So yeah, that's a question for this one.
Okay, cool, thank you. So I have looked a little bit at this, and I think the first piece is, in terms of a good privacy protective app, I always recommend Yuki. I'm sure you've looked at it, but for others, EUKI, it's incredible. It is actually privacy forward. It was designed with your privacy in mind. I think of it as like the Signal of period tracking apps and femtech apps. I think one of the big things, there's two pieces of this. One is privacy related, and one is, I guess, cybersecurity. I'll start there. A lot of these apps are using algorithms that are not externally tested. And that's a big issue because then they're not as effective, or we don't know exactly what they're relying on. So that's a big piece that we're actively trying to tell legislators about, to see if there's a way to regulate and just get better insight on. So I think that's one thing, is understanding what is the technology behind these femtech apps and how does it work. And then in terms of user data that's collected, or something to keep in mind with privacy policies, the big thing right now is just seeing, where is this data going? What data is collected? How much of it includes PII, so personally identifiable information? And even if not, what other data is collected that could be related to personally identifiable information, and where is that being sent? So there's some interesting research happening there. I think my email is on here. Please feel free to stay in touch. I don't have business cards because I'm going to a new job, but email me, and I'd love to stay in touch to share some more of those resources, because there are some scholars also doing this research. But I think those are kind of the key areas where we're looking at the tech, and then also what's in the privacy policy itself.
Got it. Thank you so much. I don't want to take up a lot of time, but there is an app that's called Clue, which is a menstrual tracking app, which they put out a newsletter after Roe v. Wade happened, like the Dobbs happened, and they said that their European law protects the data, even if US government asks for any data. Do you think telling people to use any apps that are on European law is better than American apps?
Sure, yeah, so yes and no. I think there's some ways in which European law obviously is there's more privacy protections built into the GDPR and European law. If a company is Europe-based, or is at least in compliance with the GDPR, it is inherently going to be more privacy protective than a US-based company. However, I think sometimes it's hard to know for sure whether they're applying the same principles in their tech when it's being rolled out in America. And at that point, if they are using different principles, and if they are collecting more data, you can't invoke the GDPR in national court, like in a court here in the US. So for menstrual tracking, we have an easy alternative where we have a privacy protective app that is US-based and that has really made privacy forward, or is privacy forward. If you don't have that, if you don't have one that you know is already incorporating privacy by design in the US, then yes, it is better to use one that might be European-based, but you still kind of need to go through and see, are they actually following the GDPR when the app is rolled out or used in the US. EFF, Electronic Frontier Foundation, is a great organization to kind of look at because they do assess what some of these apps are doing. So I would recommend checking them out, but that's kind of how I would approach that situation.
Right. Thank you so much for answering my questions.
Thanks for a great talk. So imagine that you've collected some data, and this data is collected in one state or something. And because you've got a patchwork of laws, when you move the data to a different state, there are different laws. If the different laws say you have to treat the data differently, are you now violating the law?
Yeah, so this is an interesting question because it involves obviously that interstate component. I am not 100% sure what governs, and it's not just me. This is something that's actually being litigated and debated because, for example, a lot of companies where the data might be collected in one state, say Missouri, but then the storage for that state is in California. Which law governs? Generally in those situations, California law is supposed to govern. California has more robust protections. If we're looking at something like the Health Information Exchange, for example, where the entire purpose of it is for your data to be mobile, for you to be able to move from state to state and still get access to your data, we are kind of grappling with what states' laws control in that situation. So I think it's something that we're gonna have to keep an eye on, and it relates similarly to some of the telehealth issues we're seeing when it comes to healthcare providers providing abortions in a state where abortion is legal, but they're providing the abortion care or sending medication to a state where abortion is illegal. Which law governs? Can that state that has banned abortion care come after that healthcare provider that's in California or in Massachusetts? So the same way that's being litigated and kind of examined as like an interesting interstate issue, I think privacy is also the same way. And there are very complex interstate, like Commerce Clause issues that are coming up that I am not an expert in, but I think I'm watching that space just as much as you are. But for the most part, it's generally where that data is where that data is stored. Those are the laws that generally tend to govern. Hope that helps.
Yes, thank you.
Yeah, thank you.
Hi, thank you. Very interesting talk. I was very happy to see you advocating for privacy by design and security by design. I think one of the really cool things about this community here is that we do a lot of the work to try to figure out what that would look like and what those details would actually be. One of the challenges that we have, though, is that we design a lot of technologies that are privacy by design or security by design, but then it's hard to get them adopted by people. Like you just talked about period tracking apps where there is one that is fairly privacy by design, but there's a bunch of others that aren't. And by the time you need it, it's too late usually. And so one of the things is there's this kind of industry coordination problem of there's a bunch of different things that some of which are doing a good job and some of which aren't, and how do we coordinate on that? And I was wondering what your thoughts are on solving the kind of coordination problem. The best analogy that I've seen is something like car manufacturers didn't want to take safety seriously for a long time. Like they didn't want to include seatbelts. No one wanted to be the first car to put a seatbelt, first car manufacturer to put a seatbelt in there, and it took regulation to require that to get all of the manufacturers behind that. And I'm wondering if you see a route forward for some kind of regulation or laws that could kind of help get some of this privacy by design and security by design to be more common and solve some of this coordination problem.
Absolutely, thank you for that great question. Yeah, I think in an ideal world, what I would love to see happen is that if we have whether it's a federal, I think it would make most sense if it was a federal legislation. If there's comprehensive privacy legislation, I think it should really incorporate privacy by design into the legislation. I don't think it makes sense to only make consumer-based laws or corporate-based laws where we're regulating what corporations do separately from what consumers do. If it's truly comprehensive, it should do both. And I think having privacy by design built in could be a really effective way to do that. But it still leaves us with this problem with companies saying, if you're forcing me to be privacy protective in the first place, maybe it's gonna be harder for my app to get adopted, or maybe people will still be like, well, why would I do this over something else? Or it's gonna take longer, and that's gonna take time away from when I could actually have users using my app and making that money. So I think one of the other pieces that we can do immediately to kind of address this, honestly, are public education campaigns. I saw a much bigger, as awful as Dobbs is, as you all have seen, for many of us that are working in the RJ landscape, stuff was already bad before. It just got way worse after Dobbs, but what it did is it made the general public, it made a lot more people that otherwise weren't super clued in on reproductive health care access, didn't care about abortion care, or weren't as invested in keeping up with that dialogue, to now get engaged. And that helped create a pathway to now, Yuki has existed for a minute, but we were able to kind of talk about it in the media and get more people engaged about it because of it. When Black Lives Matter happened and more people were protesting, Signal kind of blew up there and was able to catch a lot more attention because all of a sudden people were thinking about how can I engage and talk to people in a more privacy protective way. So I think having more of those public education campaigns, whether it's companies partnering with government entities, that's something I really want to do and I think would be really cool and has been really effective in other ways. But public education, working with those reproductive justice-like orgs, working with community organizers to make sure that those communities that are especially the most impacted, the most surveilled, and could benefit the most from privacy protective measures, getting the information out to them is really critical. I think that's a piece that's hard right now. A lot of these apps maybe don't have the resources themselves, the technology companies don't have the resources, or they don't know how can I get in touch with the communities that need this the most. I think bridging that gap is something we can do immediately while we wait to see if our federal government, if Congress can actually come up with legislation that can help. I agree, I think it would be great to regulate it, but I think that's something, an active communications campaign, public education campaign, where we're really kind of building bridges with organizers, and you great folks building this tech is gonna be really integral.
Very cool talk. I'm just curious, so in the talk, you had a slide where you have a bunch of, basically a bunch of apps, and all the apps are collecting your data, right? And you kind of picture, I guess my take is that you sort of talk about two ways that, government, law enforcement agencies can grab your data, right? So there's one way, which is they get it from a third-party provider. The other way is, right, that's the slide. The other way is through a subpoena/warrant, right? So I'm just curious, from your experience, which approach do you think government agencies use more often? Because my understanding is that, right, if it's subpoena, you only get metadata. For warrant, you actually need a lot of work, right? You need a probable cause, a bunch of stuff, right? You need to write a letter to the judge, stuff like that, right? So, I'm just trying to understand which approach do government agencies use more, because if it's the first approach, right, you can imagine even you have one app that is privacy by design, Amazon's not going to do that, then it still doesn't protect you per se, right, or it has partial protection. If it's the second approach that they use more, then maybe the law needs to change, right?
Yeah. So it's interesting. Thank you for asking. I think one important piece to note is that it really depends on the case. So it's not a preference as much as at what point in the legal process are they trying to access this data. That will kind of determine if they're going with a warrant or if they're going to go with a subpoena or some other type of court order. Effectively, think of it as just different ways to understand that the judicial system is getting involved to grant law enforcement access to this data. That's the way to think about this, because depending on whether or not we're at the probable cause stage where the prosecutors are trying to decide if we can charge the case, the most likely option there is going to be a search warrant. But if we're in discovery, we're likely going to be looking at a subpoena. So it depends on what level we're in. What's important here is under all of them, the bar, while it might in legal terms is somewhat high, when it comes to getting access to this technology, it's pretty low. They can kind of establish a pretty wide net on what types of data is being collected. At least that's what's happening in the majority of restricted states right now. And the bigger issue is, you gave the example of Amazon. I understand they're not going to incorporate privacy by design. Fine. What is problematic is this third-party access that they're granting. So Amazon Ring, for example, has a system right now where they're already contracted with government law enforcement agencies. So if you have a Ring doorbell camera, you're already collecting data, and law enforcement can get access to that data without even necessitating a court order or search warrant. In Illinois, I worked on a piece of legislation that actually tried to regulate this, and it did the bare minimum. All it said was that, okay, this back door, this third-party access that Amazon Ring has created where it provides law enforcement officials with access to this data is not really legitimate. They have to get a court order. And every case where they would have just gone to Ring on their own to get that data, now they just get a court order search warrant. So the loophole is pretty wide, and I think the mechanisms just differ based on what level we're in. I think closing up that other backdoor, that third-party immediate access that we have, is what's really critical and ideal. If we can do that, that's going to be a much quicker fix than addressing the court order, subpoena, search warrant, narrowing those laws, because those have been in existence for a long time, and that judicial process is going to take much longer to fix.
Thank you.
This will be the last question. You will ask it quickly.
Sorry, I'll try to be brief.
You will answer it quickly.
Okay.
First of all, thank you for organizing this keynote. I think this is a very important topic that we are discussing here. But the fact remains, kind of going back to the previous question here, that until and unless there is a law in place, doesn't matter how much we advocate for it, because I think every paper here is talking about changes made to the privacy policies. So how can we make sure that lawyers like you, who actually did the research while talking to the community of privacy and security, and people like us who are working digitally towards this can work together to actually make changes? Because we can advocate as long as we want.
Yeah.
Unless and until there are some penalties, the companies are not going to listen to us.
I agree. I completely agree with you. And it's almost like sometimes we feel like we're just knocking our head against a wall, because it's like, when are we going to see the change? How are we going to do this? I felt that for sure. I think one, connecting here is really helpful. There's a lot of lobbyists from tech companies that are in the different legislatures. And that's, honestly, it's a problem, because whenever when we have advocates that are privacy advocates that are trying to advocate for more privacy measures, more often than not, when I'm going up against someone, the people that are fighting against the regulations that I'm promoting are going to be lobbyists that are from tech companies. Until there's a changing of the guard across the board, I think it's going to be much harder for this to all live in harmony. But the more we're able to work together, the more privacy advocacy groups are connected with tech companies, the more the lobbyists that work for y'all or for tech companies that you know are able to work with advocates and understand the need for privacy. Until we are able to achieve that, it's going to be much harder. What gives me hope is that you all are here, is that the younger generation, the folks that are studying this, that are doing this research, you care about privacy in a way that 5 years ago, 10 years ago, nobody cared. When I went to law school, which was not too long ago, but still long ago, nobody really understood privacy, or there was like a handful of us that would take those classes. Now, there are at least 5 to 6 different classes dedicated to information privacy law at almost every law school that's offered at different levels. That's a major shift. And so I think we're seeing a change in the game, but and we're seeing more legislators tap into it and care. We just have to be more thoughtful about making those bridges and making those connections. So stay in touch, check out ACLU, EFF, Fight for the Future. There's some really great nonprofit orgs that are doing really important privacy regulatory work. And like I said, stay in touch with me on email or Twitter, and I'm happy to share more. But this is what gives me hope, and I'm hopeful that we can continue these conversations, not just us, but also other privacy advocates. Hope that was fast enough.
It was great.
Thank you.